In this 9-minute recording, you will learn about the most common gram-negative pathogens that cause disease in humans and the antibiotics used to treat the pathogens. With a pink appearance when gram-stained, gram-negative bacteria are more difficult to kill due to their cellular composition. Gram-negative bacteria have a complex lipopolysaccharide outer cell membrane which impairs the immune system from recognizing it as a pathogen. Presence of porin channels disarm the antibiotics by blocking entry into the cell. Common gram-negative bacilli include respiratory pathogens, Klebsiella pneumoniae, Legionella pneumophilia, and Pseudomonas aeruginosa. Urinary pathogens include E. coli, Proteus mirabilis, Enterobacter cloacae, and Serratia marcescens. GI pathogens include Helicobacter pylori, Salmonella enteritidis, and typhi. Starting with gram-negative cocci, there are 4 common pathogenic species: Neisseria gonorrhea, known for causing sexually transmitted infections; Neisseria meningitidis, causing a fatal form of meningitis; Moraxella catarrhalis, and Haemophilus influenza, both known for causing infections like sinusitis, otitis media, and pneumonia. Appropriate antimicrobial therapy for Neisseria gonorrhea and meningitidis includes third-generation cephalosporins, sulfonamides, and macrolides. Treatment of Moraxella catarrhalis in Haemophilus influenza includes augmentin, third and fourth-generation cephalosporins, macrolides, or fluoroquinolones. Starting with common gram-negative bacilli respiratory pathogens, third-generation cephalosporins, fluoroquinolones, or aminoglycosides are used for Klebsiella pneumoniae, macrolides and fluoroquinolones for Legionella pneumophilia, and a combination of ampicillin and third-generation cephalosporin, aminoglycosides, or fluoroquinolones are used for Pseudomonas aeruginosa. Now for urinary pathogens. Cephalosporins, fluoroquinolones, and sulfonamides are used for E. coli, fluoroquinolones, sulfonamides, and nitrofurantoin for Proteus mirabilis. Penicillins or cephalosporins are effective with the Enterobacter cloacae species, and combination therapy of penicillin and a cephalosporin or aminoglycoside for Serratia marcescens. Last is the GI pathogens. Penicillins and macrolides can be used for Helicobacter pylori, macrolides, fluoroquinolones, or cephalosporins for Salmonella typhi, and cephalosporins or fluoroquinolones for Salmonella enteritidis. Compiling a list of all of the antibiotics we reviewed, we have penicillins with or without clavulanic acid, cephalosporins, macrolides, aminoglycosides, urinary anti-infectives, sulfonamides, and fluoroquinolones. Penicillins and third and fourth generation cephalosporins are not only used for gram-positive bacteria, but sometimes gram-negative too. Most gram-negative bacteria are resistant to penicillin, so clavulanic acid is added. The suffix to look for is -cillin, and prefix for cephalosporins is CEPH or CEF. Both antibiotics work by inhibiting bacterial cell wall formation. Clavulanic acid inhibits bacterial production of an enzyme called beta-lactamase. Beta-lactamase deactivates penicillin from working, but adding clavulanic acid prevents that from occurring. Adverse drug effects of these groups can include hypersensitivity, rash, and GI upset. Augmentin is an antibiotic famous for causing severe diarrhea and disruption of gastrointestinal flora. Anyone with prior allergic reaction to either drug category should avoid taking these drugs due to their molecular similarities. And unless the patient is planning to be a parent, they should use alternative forms of birth control. Macrolide antibiotics include azithromycin, erythromycin, and clarithromycin. All have a suffix of mycin. These drugs work by inhibiting protein synthesis, preventing bacterial cell replication. Adverse effects can include GI upset and immune system modulation and should be avoided in patients taking the gout medication colchicine. Aminoglycosides include the drugs gentamicin, tobramycin, and amikacin. CIN is the common suffix among this group. Like the macrolides, aminoglycosides prevent bacterial cell replication by inhibiting protein synthesis of the bacterial cell. Hallmark adverse effects include ototoxicity and nephrotoxicity. Therefore, aminoglycosides are contraindicated in patients with auditory or renal impairments. Levofloxacin and ciprofloxacin are examples of the fluoroquinolone antibiotic category. These drugs have a suffix of oxacin. Fluoroquinolones interfere with bacterial cell replication by inhibiting enzymes necessary for DNA replication. Adverse drug reactions unique to this category include weakening of cartilage and tendons, possible ventricular disturbances, or seizures. Fluoroquinolones are contraindicated in pregnant women and used with caution in the pediatric population due to the adverse effects of this drug category. Sulfonamides are a group of antibiotics that usually have sulfa in the name. Sulfonamides prevent folic acid production, a necessary ingredient in cellular replication. Sulfonamides are associated with hypersensitivity and a wide variety of rashes. Patients with known sulfa or thiazide allergy or anyone with an underlying folate deficiency should not receive sulfonamide antibiotics. Next is the urinary anti-infective nitrofurantoin, which works by preventing DNA replication of the bacterial cell. Hallmark adverse effects include pulmonary and hepatic toxicities as well as neurological abnormalities such as paresthesias. Therefore, anyone with underlying pulmonary, liver, or neurological abnormalities should not receive this drug. Which antibiotics should be avoided in a patient with history of allergic reaction to the antibiotic amoxicillin? Ciprofloxacin, cefuroxime, azithromycin, or trimethoprim sulfamethoxazole. The penicillin and cephalosporin antibiotic groups are molecularly similar. Therefore, if a patient has a history of an allergic reaction to a penicillin antibiotic, cephalosporin antibiotics should be given cautiously. With history of anaphylaxis to a penicillin antibiotic, cephalosporin should be avoided. Which antibiotic has potential adverse effects of tendon rupture, cardiac arrhythmias, or paresthesias? Ciprofloxacin, cephalexin, ampicillin, or amikacin? The fluoroquinolone antibiotic category has adverse effects of tendon rupture, cardiac arrhythmias, and neurological abnormalities such as paresthesias. Antibiotics in this category can be identified with the suffix of -oxacin. Of the antibiotics listed here, the correct choice would be ciprofloxacin. Gram-negative bacteria are more difficult to treat due to which of the following characteristics? Presence of porin channels, peptidoglycan cell membrane, outer lipopolysaccharide membrane, in presence of endo-exotoxins. Gram-negative bacteria have an outer lipopolysaccharide membrane which disguises surface antigens of the bacteria, limiting the immune system's ability from quickly identifying the pathogen. Presence of porin channels block the entry of many antibiotics and also have the capability to produce both endo and exotoxins, causing damage to cells and the host collectively. Which generations of the cephalosporin category are best covered for gram-negative bacteria? First generation, second generation, third generation, fourth generation. All generations of cephalosporins have some element of gram-negative coverage. However, the third and fourth generation groups cover gram-negative pathogens more broadly. That wraps up our presentation on antimicrobial therapy for gram-negative pathogens.